Hello everyone, welcome to channel My Health, My Life. Today I have a topic which is related to diabetes mellitus. In this video, you will know about the definition of diabetes mellitus, the causes, special sign, diagnosis, medical, and looking care. We can know it is diabetes mellitus by measuring blood sugar level in the morning before breakfast, and it shows the result of over 126 mg per deciliter after when we measure it for twice in different conditions. Or another way, HbA1c is bigger than 6.5%, or it shows the result of over 200 mg per deciliter when we measure randomly glycemia. Thus, we can say it is diabetes mellitus. Is it enough to know the definition? Well, it is not. We should know what are the causes of this disease. Diabetes mellitus occurs of two main causes. The first one is that our insulin is resistant. It cannot be used. This means the insulin released from pancreatic is unuseful. And for the second one is that it is produced too less. Now I will show some images related to pancreatic issue. This is the image of pancreatic. Generally, pancreatic produces normal and useful insulin. When we have diabetes mellitus, the pancreatic is broken, so it sometimes produces not enough insulin or enough but unuseful insulin. Other causes are genetic and diet factors, too much alcohol drinking, and overweight. There are four focal marks we should focus on: much drinking, much urine, much eating, but then still lose weight. These four marks can make you suspect that you might have diabetes mellitus. Other signs like low vision and extremity numbness are the consequences. You may have further questions requesting to do diagnosis to be sure that you have diabetes mellitus. Well, firstly, you have to follow up your morning blood sugar. Is it over 126 mg per deciliter? Or you can follow up checking HbA1c for at least 3 months duration. Is it over 6.5%? Or other way, you can measure randomly glycemia. If it is over 200 mg per deciliter, it means you have diabetes mellitus. And for these three methods, you will have done by doctor's prescription and to make sure you are having the disease. After you have done on the diagnosis, you should better know about the treatment, and this is important, so I will show you some main treatment. For the treatment, we use drug, injection, and nowadays we also use surgery, releasing cholesterol from abdominal. For drug treatment, we use metformin. I'm showing you for clear. This is image of metformin, which is used for the first line. It names glycophage. According to new study, its best side effect is less harm, and it helps your heart away from heart attack. If your body is intolerant with this drug, you can change to use another one. It is dimicron or glycoside. Glycoside has its dose of 30 mg and 60 mg. You have to be sure that you use it when your body is intolerant with glycophage. Generally, treatment by drug is not fit for patients who has diabetes mellitus for a long time, so we use injection instead. For treatment by injection, we select insulin that it has three actions, which are short, medium, and long action. Besides this, we also use releasing cholesterol from abdominal and intestinal bile surgery to release cholesterol from blood, and then it causes blood sugar decreases. So, the right treatment is that we make it from low to high level. You should not treat with any method you want, but you must follow to doctor's prescription. After you know about treatment, you should know some about consequences of the disease. Mostly, diabetes mellitus harms your body. I will show you some examples in the picture. Starting from head, it will make you stroke if it impacts your vascular. It will make you have low vision if it impacts your eye. Also, it will impact your kidney failure. And the most concern is that cutting leg. If you have the disease for a very long time and you do not follow up with doctor, you will face the situation of vascular obstruction at extremity, and then there's only way of cutting leg. So, to avoid from these consequences, we must know how to prevent it by having good diet, less sugar and cholesterol, doing exercise for at least 3 minutes every day or 4 to 5 times per week, and follow up health checking with doctor regularly. The best and simple way is drinking of much pure water to decrease blood sugar. At the end of this clip, I would like to mention that you have to follow doctor's prescription and careful risk. Don't ignore it, because diabetes mellitus is very heavy if you are careless or don't get any treatment. So finally, I wish you all have good health. Thanks and see you.